Welcome. My name is Dr. Jean Elwing, and I'm a professor of medicine and the director of the pulmonary hypertension program at the University of Cincinnati. We're going to be talking about measuring risk and the impact of Orenitram. It's important to follow risk and reassess it routinely because otherwise you could possibly miss a change in patient status that could have been picked up earlier. So if you see a patient and start them on a medication, it's not enough to ask them a few questions and see them 6 months later. We have to check in, and we can do that multiple ways. We can do that virtually. We could do that face-to-face, but we need to do something in an organized way and see them back at a regular schedule, usually 1 to 3 months, depending on severity of illness, and reevaluate. Those in between are the ones we have to watch with risk assessment. If they're having subtle functional capacity changes, decrease in their walk distance, increase in their BNP, changes on their echocardiogram, we need to pay attention. And when we're tracking that risk assessment, we can pick that up in a formal way. The information from Freedom EV can help us figure out when to add an oral prostacyclin to the medication regimen for our PAH patients. It is not something we want to go about doing when our patients have advanced hemodynamics and functional class 4 symptoms. We want to think about Orenitram in our patients earlier in disease. Adding Orenitram has been demonstrated to improve several key indicators of risk as well as overall risk. I think this is important because that is what we're watching in our patients with PAH and how medication is affecting them. But when we looked at the secondary endpoints in Freedom EV, we found other important risk modifications. 50% of patients taking Orenitram improved their walk distance by more than 25 meters at 36 and 48 weeks. 89% of them were able to improve or maintain their functional class at 24 weeks. 96% of the functional class 2 patients receiving Orenitram maintained 3 low-risk criteria in the French assessment at 24 weeks. That was 27 out of 28 patients, as well as 36 weeks, 24 out of 25 patients. So we're not just impacting worsening by adding Orenitram. We were impacting multiple non-invasive parameters that we use to assess risk globally in our patients. So putting it all together, Freedom EV was able to show us that Orenitram was able to impact multiple parameters of risk and overall disease progression in this long-term study.
Orenitram treprostinil extended release tablets. Indication: Orenitram is a prostacyclin mimetic indicated for treatment of pulmonary arterial hypertension, PAH, WHO Group 1, to delay disease progression and to improve exercise capacity. The studies that established effectiveness included predominantly patients with WHO functional class 2 through 3 symptoms and etiologies of idiopathic or heritable PAH, 66%, or PAH associated with connective tissue disease, 26%. Important safety information for Orenitram. Contraindications: avoid use of Orenitram in patients with severe hepatic impairment, child Pugh Class C, due to increases in systemic exposure. Warnings and precautions: abrupt discontinuation or sudden large reductions in dosage of Orenitram may result in worsening of PAH symptoms. The Orenitram tablet shell does not dissolve. In patients with diverticulosis, Orenitram tablets can lodge in a diverticulum. Adverse reactions: in the 12-week placebo-controlled monotherapy study and an event-driven placebo-controlled combination therapy study, adverse reactions that occurred at rates at least 5% higher on Orenitram than on placebo included headache, diarrhea, nausea, vomiting, flushing, pain in jaw, pain in extremity, hypokalemia, abdominal discomfort, and upper abdominal pain. Drug interactions: co-administration of Orenitram and the CYP2C8 enzyme inhibitor gemfibrozil increases exposure to treprostinil. Therefore, Orenitram dosage reduction may be necessary in these patients. Specific populations: Animal reproductive studies with Orenitram have shown an adverse effect on the fetus. There are no adequate and well-controlled studies with Orenitram in pregnant women. It is not known whether treprostinil is excreted in human milk or if it affects the breastfed infant or milk production. Safety and effectiveness of Orenitram in pediatric patients have not been established. Use of Orenitram in patients aged 65 years and over demonstrated slightly higher absolute and relative adverse event rates compared to younger patients. Caution should be used when selecting a dose for geriatric patients. There is a marked increase in the systemic exposure to treprostinil in hepatically impaired patients. Please see full prescribing information and patient information at www.orenitram.com or call 1-877-UNITHER, 1-877-864-8437.